Republicans are indeed saying, I told you so. They've been warning a lot about this, including my next guest, the House Majority Whip, Eric Cantor. Congressman, what do you make of this?
Neil, I tell you one thing. This is just bad news that keeps on coming about this bill. Our argument all along was we need to affect health care reform in a much more modest, incremental way that can be economically sustainable. First, we need to focus on saving costs for taxpayers so that people can afford health care.
Congressman, what if my last guest is right and just says that these are all things that could happen, but there's enough good here, including savings, that negate that? You don't buy that.
Well, CMS has an independent analysis that came out yesterday, Neil. This is a nonpartisan, independent figure which came out and said this bill will increase health care costs over the next 10 years by $311 billion. And we also, I think the most frightening bit of news here is the statement that perhaps the Medicare program could be put in jeopardy because, number one, there's over $500 billion, over $1 trillion of cuts to Medicare. 50% of the seniors who have Medicare Advantage right now, which is the choice piece of Medicare, will no longer have that. We also see language in this report which says that hospitals and other providers won't be able to continue to participate because of the structure of this bill. Again, we had said all along, trying to do this transformational change, a $1 trillion bill, which we now see will cost over an additional $311 billion in terms of our health care costs.
But flip that around, though. But your point's well taken, Congressman, but flip that around. If the argument is we don't need as many hospitals if we move to these health community centers that a lot of Democrats and those who signed off on this were bragging about, maybe net good. What do you say?
Well, Neil, if you remember, over a year ago, we were at the White House at the healthcare summit the president hosted. He started the discussion by saying, you know what, we need to bring healthcare costs down, but we also have to make sure that people who have healthcare coverage they like can keep it. Well, this report right there goes to the heart of both those matters. Number one, it says we're not bringing down costs, and number two, it says that millions of Americans will no longer be able to have the health care they know because of this bill. So right away, we see a little less or over a month from the passage of the bill, promises being broken, which is why, Neil, you hear us on the Republican side of the aisle saying, you know what, we need to repeal and replace this bill with the kind of health care that Americans want, which is lowering costs, which is providing.
Well, that's an uphill fight. That repeal thing's an uphill fight. You will grant that, right?
Well, I mean, clearly, Neil. But we've got to go and set the goal out there that we need to repeal this thing and replace it with health care that works.
All right.
Not an unsustainable dream that, frankly, will bankrupt this country.
Eric Cantor, a pleasure. Thank you, sir.
Thank you, Neil.